So, moving on to the chest, we've already done an overall inspection, but now we're going to just have a little bit of a closer inspection. So, the main scar is what we call a midline sternotomy, and it would be down here. Let's look very closely in some patients, so do just take a second to make sure you haven't missed it. You can also sometimes have scars around the edge, so just make sure you're not missing any there. And the other thing in a cardiovascular exam is always have a look in the infraclavicular fossa, because that's where they put pacemakers. At the same time, pacemakers can also be around here. If you see one, you should palpate it to check that it's not tender. Okay? Once you've done that and you're happy with those scars, the next thing is to palpate the apex beat. To do this, take your whole hand and just place it just below the patient's nipple. You're feeling for any impulse. Once you feel that impulse, start to localise where it is. And when you find it, you now need to check whether it's in the right position or not. To do that, you count down 1, 2, 3, 4. So this is in the 5th intercostal space. And it's here, which is the midclavicular line. And that's where you'd expect the apex beat. If it was anywhere else, then it's displaced. After you've done that, you move on to assess for any right ventricular heave by placing a hand at the lower left sternal edge. And then you want to assess for any frills, which are a palpable murmur, by taking the edge of your fingertips into the 2 second intercostal space.